What inspired you to want to do research?
Well, as a practicing physio, I've always worked with people with experiencing musculoskeletal pain. And when I was practicing, I was always really interested in the stories of patients. So I was interested in understanding how they made sense of their pain symptoms. But as clinicians, we're really trained to find sort of objective signs of dysfunction and to fix them. And that's really important. But I always felt that we could learn a lot from listening to the stories of our patients. And trying to understand their beliefs about what they think are causing their symptoms and what to do about them.
And why osteoarthritis?
Yeah, so one of the other things that I'm really fascinated in is around pain mechanisms. So how we can have sort of objective signs of, for example, joint pathology. But this pathology is experienced really differently by different people. And osteoarthritis is a really nice model to explore some of these different experiences just because it's so common in the community.
What would you say is your favourite part of your research career?
My favorite part is probably listening to these stories. Because I've moved away from clinical practice now, I feel really privileged that I still get to stay really close to our patients, so that I get to hear their stories still through all the interview work that I do. And that's probably the bit that I like the most.
Do you have any advice for budding young researchers?
I think my advice would be not to let rejection knock you down, and really hold on to the fact that we can't change the world, but we can sort of add a little piece into the jigsaw and help in some way.
And lastly, and most importantly, what is your favourite flavour of ice cream?
So an easy one, and I'm very standard, but chocolate.
Yes.